St. John's wort is one of the well-studied herbal supplements. It has more than 200 clinical trials and most of them shows positive results, and its safety profile is also high and most patients well tolerated. St. John's wort, also called natural antidepressant. Let's explain mechanism of action. Mostly it affects serotonin levels. It increases serotonin level by inhibiting reuptake of serotonin from synaptic cleft. It binds receptors and inhibits reuptake of serotonin, and it means high serotonin in synaptic cleft. High serotonin means improved mood. Main acting ingredient of St. John's wort is hyperforin. Hyperforin increases level of serotonin, also other neurotransmitters including dopamine, norepinephrine, GABA and glutamate. Another important ingredient is hypericin. Hypericin previously was thought it was important and main component, but now we have studies according to this it's secondary and it has more antiviral and antibacterial action. Why is so important St. John's wort? Why we pay so much attention it? Because we have studied several important large-scale studies where it is compared to sertraline and fluoxetine, prescribed antidepressant drugs, and St. John's wort shows almost same effectiveness as fluoxetine and same effectiveness as sertraline. Sertraline is same as Zoloft. Fluoxetine also very popular antidepressant. So St. John's wort shows almost same effectiveness as these prescribed antidepressants and higher safety profile, less side effects. Usually St. John's wort is used for treatment of depression, usually mild to moderate, not severe, anxiety disorder, PMS and menopause. John's wort usually have no important side effects, but it can cause dry mouth, dizziness, diarrhea, nausea. Dosage usually 300 mg 3 times per day. But we should remember that its half-life is around 1 day, sometimes 2 days. John's wort would be almost perfect supplement, but it has very important limitation and its medication interaction. St. John's wort activates Cytochrome P450 in liver, and it causes important medical interactions, which means it decreases effectiveness of other antidepressants, birth control pills, anticoagulants, HIV medications, immunosuppressants, and certain cancer medications. So this is huge limitation, and we should be very careful using St. John's wort. It may be worse in otherwise healthy people, but if person takes several medications, we should be very careful and we should study further. Also, if we say if it's recognized by authorities and guidelines in Europe, especially in UK and in Germany, St. John's wort is used very actively in treating depression, but in USA it is not recognized in guidelines, so that's limitation also. That's all. Thank you very much. Thank you for your attention. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.